Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And our guest today is Tamir Hussain. He's Director of Operations at Indiana University Student Health Center. Welcome, Tamir.
Good morning. Thank you for having me.
Yeah, excited to be here at the eClinicalWorks National Conference, diving into a lot of interesting topics. In fact, our favorite topic, ambient clinical voice. But before we go there, tell us a little bit about yourself and Indiana University Student Health Center.
Yes, so Indiana University, we are a Big Ten university. We do have the largest school of medicine at the Indianapolis campus. At the health center, we have obviously the medical clinic. We have travel immunization, counseling and psychological services, physical therapy, an eye clinic. So we do have a pharmacy, on-premise, lab, radiology. So it's kind of like a mini hospital.
Yeah. I mean, it's interesting. I think I'm uniquely qualified to talk with you since that's where I started too, was the student health center, counseling center. So it's fun to kind of have flashbacks to my days when I started learning about EMR. But yeah, tell me, what are some of the unique challenges and even opportunities you have at a student health center? And talk about how ECW has kind of helped you with some of those challenges.
So we implemented ECW back in 2011. And again, we had a choice of a lot of different college health specific EMR systems. But for us, this was a very strategic and deliberate choice to select ECW. We wanted a product that would scale with time and have the functionality and features that we envisioned. So I think we completely satisfied, would never change our decision. So ECW has been a good partner. And again, challenges with the patient portal, we have a single sign-on for the students. They don't need to remember unique passwords for the patient portal. They just use their university credential, sign in, online scheduling, televisits. So ECW basically takes care of all of that.
Yeah, I think that's one of the things people don't understand about student health. You have this kind of defined population that comes to see you for the most part.
Yes.
And so, but there are unique opportunities, like you said, the single sign-on. You know, no one else does that, right? Because they don't have a,
yes.
I mean, some employee clinics or something maybe you could do as well. But yeah, so that's awesome that ECW adapted for you. You know, you've been recently looking at Sunoh and implementing that with your organization. Talk to me about what your and your staff's initial reaction to Sunoh is.
So again, you have the most expensive resources, our providers. You don't want them spending time just doing basic data entry.
And they don't want to either.
Yes, exactly. It's a big stress point for them that, am I going to have the note done in time? Do I have to come back and look at my notes? And did I miss anything from the previous encounter? So when I saw the demo for Sunoh, it was like, I want to be one of the first pilot users, and we did that. Initially, the providers were a little hesitant. The terminology AI is not understood. It's getting there, but it was like, I don't want artificial intelligence doing, but it's not that. Right. So really, it was just having somebody come in, doing the voice signature for Sunoh, and doing a test note, and just having all of the documentation there for you was really amazing. And the providers that were hesitant in the initial stages, they just started using Sunoh for every encounter. And the common term I hear from them is, this is a game changer.
Wow. That's interesting. I mean, let's go talk about that whole adoption of AI. I think we've been burnt by the idea that AI is going to solve everything. Maybe Hollywood ruined us a little bit, right? And so I think, you know, and we heard about it's coming for decades. But what's fascinating is that, like, now, like Sunoh is an example of it really being here, right? Is that kind of what they went through? Is this like, you know, is truth reality?
I think so. It's, again, just over the last 10 months since we've started using Sunoh, just realizing the limitations right now and how basically in the future, some things were like you need to basically have queues, just like Girish pointed out in the demo, that having queues where Sunoh can then say, okay, this needs to go into this section of the progress note. We basically implemented this out of the box without any specific training, and it worked so well. But now, as ECW is doing further enhancements, the product, it's going to be fantastic.
Yeah. And I thought that was an interesting move in the keynote, right? A lot of times the old templates, if you will, that we used to document were almost like a checklist for the doctor.
Exactly.
And now we're removing that checklist, like how do we prompt them to it? I think it's an interesting part of this evolution.
And I would like to add, one of the biggest things for us at the Student Health Center, this is our demographic. This is the first time they're basically making their own appointments without their parents. And they have the first interaction with the healthcare provider. And it's not going to be a provider that's basically looking at their monitor and typing and not having eye contact.
That's really interesting.
But Sunoh actually provides that opportunity for the providers to actually have FaceTime and listen and have the really good connection as a provider and patient. So that's really important for us.
Yeah, I love that. That's really cool. And how did you roll it out? You talked about doing an initial pilot, but have you rolled it out to everyone? How did you decide to kind of bring Sunoh into your organization?
So again, hesitation. Providers are creatures of habit.
Yeah.
They don't like anything new. So it was really like grabbing a hold of someone, like, okay, let's do a demo. And just in the demo, they're like, okay, I will give this a try. And then just looking at the metrics in the Sunoh recording, then I can see like, okay, this provider is using it for every appointment now. Then there's the healthy competition amongst the providers that...
Gotta leverage that. Med school ingrained it in their minds.
How is provider A completing all of their notes before the end of the day? I want that as well.
Interesting.
So again, it's like, use this. I can give you an example for our physical therapy.
Yeah,
they absolutely love Sunoh. And anytime something goes wrong, and it's mostly user error, they're like immediately calling, hey, Sunoh's not working. And it's sometimes like, oh, the microphone's muted. Sunoh works.
Yeah, that's interesting. That's great to hear they like it so much. And you talked a little bit about the onboarding. Tell me a little bit more about that. And has that evolved? Initially, it sounds like you did a demo and kind of let them do. Have you evolved your training and onboarding with clinicians?
So again, initial providers, then they kind of spread the words. The peer-to-peer recommendation has more weight than me recommending this product to the providers. Yeah. But I basically reach out and say, hey, you aren't using this. Find 5 minutes, that's all I need. Let's do a demo. If you don't like it, don't use it. The sections you do like, use that.
That's awesome.
So they've been very receptive.
Interesting. Have you heard from them that they've had to change anything they do? The obvious one with ambient clinical voice is you have to say things rather than just think them, because the AI can't hear your thoughts yet.
Yes. So they have evolved.
Okay.
As they've done more and more encounters, they kind of have picked up the small cues, like, okay, when I say this, then the documentation is more complete. So just like the cues, now they have like a verbal cue, like, okay, I'm going to do the examination. Then Sunoh will basically document that in the examination section. But even if they don't do that, they are surprised that Sunoh was able to pick this up and is presenting the proper ICD codes to confirm. So
that's interesting. Yeah, I think that's the other thing that patients benefit as well.
Correct.
Because now they're being more articulate with what they're actually doing and what they're thinking. And I've heard this over and over. Patients love it. So that's awesome. Talk to us about how it's impacted your organization and kind of what's been the staff reaction. You said a game changer. Do you have any other metrics or anecdotes about how it's impacted them?
I think again, I would like to stress the most important thing for me is the quality of care. What the patient gets from the provider. That's by far the most important metric to me, that they get the proper one-on-one with the provider, and they're satisfied with with their visit. We, in fact, have surveys where we ask, did you feel like the provider explained the diagnosis and the treatment plan? And, we score 5 out of 5 in
Nice.
that. Again, it's a student health center. We don't expect providers to see 40 patients a day. It's really like, okay, whatever your bandwidth is, we want you to be comfortable and relaxed when you see your patients. So again, I think I can easily say the quality of care is going to be at the foremost, the most important thing. Just having the FaceTime, the personal connection with the patient.
That's what makes student health so wonderful.
Yes.
You really do care about the students. It's part of the mission of the organization.
And again, our part is to basically educate the students about healthcare. Again, so they are better consumers down the line. They're adults now, and we want to give them like a proper good stepping stone into adult life.
Yeah. Speaking of the students, how have they reacted? Have they been, reticent? Do they love it? What's
No,
the reaction?
so our demographic, they're very tech savvy.
Yeah.
When the provider does mention that, hey, I'm going to turn this on, and they like tell me more about this, and they're just fascinated. They love the technology.
Yeah, I think it's probably almost the opposite. They're like if they weren't using it.
Yeah. Now again, students use AI, Copilot, ChatGPT to do their assignments, so they're familiar with AI and what that can do. So again, I think we haven't had anyone that said, hey, I don't want this enabled. I just want this turned off and a normal appointment. So we haven't had anyone complain about that.
Yeah, that's awesome. We're still so early in this AI medical scribe. So I mean, it's great to hear it's having an impact already, but it still feels early days for what's possible with these AI assistants. Where would you like to see Sunoh and ECW go next with it?
So a lot of the stuff that I wanted, I saw that in the keynote. So I'm super excited about
awesome.
AI with the EBO reports and all of the other AI assistant stuff. But Sunoh, again, I think just being pioneers in this field with ECW, I think right now it's just fine-tuning what it does. And I can see that they're not just resting, that done, this product is good. They are improving. So just like the queues, all of making it more smarter, perhaps scheduling an appointment on the fly. I know it can do like future appointment and stuff, but actually doing the appointment and all of that stuff, which I think with the overall product that's tied with the AI assistant, it should be able to do it. So
yeah, I mean, in some ways, they kind of already have the functionality in other parts of the software. It's just rolling it into Sunoh. Clinical decision support would be a similar type of thing, I think.
They do. And again, when we get questions at the university level on a listserv, it's like, yeah, we're doing this. Our system already has this. And we've seen demos where the other EMRs are like, yeah, we're planning on having something similar, but we've been using it.
Yeah, you're 10 months in.
Yes.
That's interesting. Awesome. Well, Tamir, this was really interesting and insightful to hear how you're using Sunoh and leveraging ECW in your organization. So I appreciate you taking time to talk with us. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcast applications. Thanks, Tamir.
Pleasure speaking with you. Thanks for having me.